Yeah, thank you, Hannah. I'll try to go through this pretty quickly. We've got only 3 slides here. There's a lot of health updates, including, and I apologize if there's some construction in the background here. The White House social distancing guidelines did expire at the end of last month, so a lot of states are being left to chart their own paths. We'll see this in a couple of slides, but just in terms of confirmed cases, we're over 1 million now, and with regard to the amount of mortality, there's been around 10,000 increase as of last week, although the number does seem to be slowing. However, we are getting information out of the White House that's saying that the death toll might hit 100,000 by the end of the year. So as medical experts continue to say that stay-at-home orders works, there's been several governors who have already opened their states, and there have been, unfortunately, record numbers in different states in some places that have reopened, including Texas and Dallas County, and I invite you to read up on those things if you're interested. As I've mentioned in previous presentations, there's not any FDA approved drug. However, we are seeing that the FDA is providing emergency use authorization to Gilead for remdesivir, which has shown early results in COVID-19 patients that they usually recover a bit quicker than folks who haven't taken the drug. So again, this has not been formally approved to treat the virus, but it does have a new oversight. In terms of economic news, we're now at 30,000 unemployment claims. So this is an additional 88 million from last week. In addition, since the last time I checked the numbers this weekend, 175 billion of the 310 PPP loans have been made. So the administration was reporting that 3.8 million loans have been made since the start of the program. Here at the Forbes Funds, we've also recognized and seen that there has been uneven distribution of the PPP loans, although it does seem like, we're hearing back that more and more organizations have become recipients of the PPP loans. So, we would just encourage you all to continue to apply for these loans. And also, we recognize that there is, in terms of access to these loans, a shortage as it relates to relationships, training, and education around these programs. So we really have been trying to use these conversations on Monday, as well as throughout our work, to highlight these inequities and also provide opportunities for our communities to get together. And then finally, I was reporting 2 weeks ago, I think, that there was some conversation around wage garnishments, and that the federal government would not be taking wage garnishments off of the checks that were coming out to individuals. The Department of Education is now being sued because they continue to garnish wages, not off of those checks, but off of other types of income. So stay tuned for more of that. On slide 2, we can see a bit of a deeper dive into Pennsylvania. There's been around 8,000 increased cases from last week, as well as an increase of around 900 deaths across the Commonwealth. In terms of unemployment, it's been noted that about hundreds of thousands of people in Pennsylvania are still waiting for their unemployment. So in some meetings last week with Secretary Alexiak from PA Department of Labor and Industry, he mentioned that the unemployment system is now fielding over 20,000 calls weekly. So the guidance from LNI is to continue to use the online system as much as possible rather than calling in. And I know even from our conversations, with regard to the built community and neighborhoods, technology access is a really big issue. And how do we impact and how do we reach folks that don't have access to this type of technology? It's certainly a conversation that we need to continue to be having. Governor Wolf also announced that 24 counties, and mostly in the north, will be moved from red to yellow. So this red, yellow, green approach is being used across the Commonwealth. And why don't we go to the next slide, and we'll see that this Pennsylvania still has no green counties as of, this will be May 8th as to when this becomes live. But we can see here that, Allegheny County really hasn't been, even in the West, Allegheny County is not the most severely impacted per capita. So I'm optimistic that things will start to improve for the conditions of, or come back to a little bit more of normality, but we'll keep an eye out on that. Beyond that, PennDOT has extended expiration dates for driver's licenses and IDs. Some news around the PA Liquor Control Board, and also considerations around emergency housing, quarantining, sheltering in place. And just to give you a comparison of where Pennsylvania is versus the tri-state area, Ohio, it has extended their stay-at-home order until May 30th, although they have had some new relaxing of the restrictions. And then West Virginia is moving to something called Safer at Home, which encourages but doesn't request people to stay at their houses. We were fortunate enough last week to have Dr. Hamlet come to speak to our group, and it was announced this Thursday that all students would receive passing grades for this fourth quarter of the school year. We're also closely monitoring things going on in the city of Pittsburgh. It looks like there's enough runway for this year with a surplus of $133 million as of last year. But we're seeing also that there's a lot of services and employment that might be impacted within the city if the federal government doesn't chip in money to support. And so around 55% of city employees are actually related to public safety. On the right-hand side there, you just see a breakdown of the $12 million in federal funding that was dispersed by the government. This was for CARES. This was for our previous CARES Act as it related to coronavirus. And I guess finally, just before I close out, we're excited that this is the first conversation that we're having in the month of May. This is both Asian American Pacific Islander Heritage Month, as well as National Mental Health Awareness Month. So we were able to bring you conversations with Mr. Julius Boatwright last month. And just beyond that, we would encourage you to reach out to your communities and find community events on both of these things. And also just in general, being Mental Awareness Health Month, check in with your friends and families and other folks in your communities. There might be ways that you can do this without technology as well, in terms of making phone calls instead, as we mentioned that there is a disparity as it relates to technological access. So with that, I'll turn it back over. Thank you.